Hi, Dr. Jen Andrade, the Active Persons Chiropractor, and today I wanted to share a self-care tip for self-massage in the lower body. And the tool or the way that I like to do that is typically with a foam roller. So we'll talk about what things to look for when selecting a foam roller and some different techniques to actually foam roll and things to just pay attention to. So foam rolling is just a way that we can kind of break up that tissue. If you have any tension or scar tissue, it may be in the front of your legs or in your glutes, this could be a really effective way to kind of get the blood flow going to relieve some of that tension and any discomfort you might be having. So let's start by talking about what we should look for when we're selecting a foam roller. So as you can see, this foam roller is pretty long. It's actually 36 inches or 3 feet. So you want something that is going to go from really the top of your head to the base of your tailbone, because sometimes we're actually going to be laying down on the foam roller and we want it to support your whole spine. So you don't want your head or your pelvis hanging off of the foam roller. The other thing I recommend is that it's something that's a little more dense or a little bit firmer type of foam roller. You don't want it to be really squishy or something that's going to give when you put your body weight on it. You want it to support you through that. So just a few things to look for there. You can purchase these in a lot of different places. I got this one on Amazon. You can get them from sporting goods stores like Dick's, and some medical supply stores have them as well. So wherever you're able to get that would be great. So let's go ahead and talk about foam rolling. We'll talk about foam rolling the front of the thighs first. So really helpful for people that sit a lot for their jobs or during the day, or maybe they do a lot of running. Anybody that's having a lot of tension here or has a tendency for that pelvis to be rolling forward, this can be really helpful for them to help release some of the tension in the front of the thighs. So go ahead and get down kneeling on the floor. Have your foam roller in front of you. So go ahead and put your hands out in front of you, kind of get into an all fours position, engage that core, and then you can go ahead and lean your thighs onto the foam roller. I like to do it together, 2 at a time, and really making sure we have that core engaged. We're not arching the lower back, and just gently rolling back and forth. You can also do this one leg at a time. I find it easier to do both legs at the same time. You can also do this for the back of the legs or the hamstrings. Also really helpful for people that sit a lot, or that maybe have been doing a lot of leg lifting. So things like deadlifts can really get those hamstrings fired up. So when we're doing the back of the legs, we want to sit right behind it, kind of get it underneath our knees. We want to lift up. And again, doing both legs at the same time, engaging the core, holding those shoulders back, and then just kind of gently rolling back and forth. Things to pay attention to: you don't want your butt sagging, you don't want your lower back arching, and you really want to make sure that your shoulders are rolling forward or caving in. So you want everything to be nice and stable. And then just kind of rolling back and forth. Here you can kind of do one leg at a time, as you can see that I'm doing. So straighten one leg and have the other one bent, then you can switch. So those are just a couple of different things that you can do for foam rolling and the lower body. Hopefully you found this helpful. Thanks for listening. Dr. Jen Andrade, the Active Persons Chiropractor.